Community Health Resource Center is in the heart of San Francisco, and we're on a mission to support the health of our community. We've been around for 40 years, and our doors are open to anyone who might benefit from any one of our services, whether it's behavioral health services, nutrition counseling, health education, or health screenings. Community Health Resource Center is uniquely effective in delivering care because of our longevity, the quality of our service, and our shared learning model. My name is Scott Plymale. I'm the Executive Director of the Community Health Resource Center. I'm a licensed clinical social worker and I have a PhD in organizational systems. I've been with Community Health Resource Center for exactly 19 years and love my work there. I feel incredibly lucky. There's always been a need for behavioral healthcare services. There was a dramatic increase at the time of the pandemic in 2020, and that's remained consistent. About 1 in 5 individuals in the United States aged 18 and older struggle with mental health illness.
In my 3 years working at CHRC, I've noticed a huge shift in the demand for mental health services. Our wait list has grown quite a lot. We're seeing more referrals, more kind of complex cases that are coming to us. Many clients, by the time they call our office, are already in crisis or close to it. And I find that many of our clients come to us after really struggling to find quality mental health care in the area. It seems like many of our clients are really overlooked by the mainstream healthcare system, and not being able to meet those needs really has a huge impact, whether it's on the individual, their family, or the broader community.
After the pandemic, a lot of the ways in which mental health services were offered shifted to be primarily virtual. That has been a challenge for a lot of patients who don't have access to a safe space to meet with someone virtually, or who don't have access to a computer, who would struggle with using technology. And so one of the really great things about CHRC is that we're also able to have licensed providers see patients in person.
CHRC really allows everybody to access a whole team. And I think that's really highlighted with the collaborative care model. And they'll also have access to a social worker, a therapist, additional consultation from a psychiatrist. And so it's very much like we are holding the patient together. I'll reach out to either Scott or to the social work team and say, hey, I'm in need of grief-specific therapy, and there will be something within Sutter where that exists. So it very much is a team approach, which is really cool. When I outreach people, I hear so much gratitude and emotion behind some of those calls because people are just really happy to be able to be connected with a therapist. Sometimes when people enter my office for the first time, they have been suicidal for years, right? They spend every day not knowing whether they want to live or whether they want to die. In our work together, seeing them want to live and make that decision that that's something that they want is not only phenomenal, but is incredibly important and is life-changing. Therapy is life-changing.
We work with people who are exceptional at what they do, who have managed to build really strong relationships with their patients, with the providers on site. They've been able to build trust with their patients, with the referring providers, which goes a really long way.
The Community Health Resource Center for the past 20 years has been providing an opportunity to train the next generation of behavioral healthcare providers. We want to formalize this process so those licensed providers can then supervise the next generation of interns and associate clinical staff. The long-term impact of the advanced learning program plants the seeds for multiple generations to support a pipeline of behavioral healthcare providers.
My experience has been really meaningful. I'm really inspired by my team. We're always in a collaborative care setting, and being able to learn from each other and be open to ask questions and reach out to each other for support.
We serve well over 10,000 individuals, and that number is growing every year. What makes me so excited about the advanced learning program is that we meet the demands in the short term by providing immediate emotional support to the people in need, but also that we lay the groundwork for future generations to come. The philanthropic funding model that supports Community Health Resource Center is the backbone of our service delivery. It's incredibly important that we get that financial support so we can raise the next generation of behavioral healthcare providers and leaders to close the gap on need. The consequences of not having behavioral health care providers impacts not only the individual person, but their families and the community. Community Health Resource Center is positioned to become the organization that can close the gap on behavioral health needs. With your help, we can close this gap together.